from a health perspective, as you know, this year has been quite an exciting year for us for more reasons than one. But COVID has really dominated the space and the national discussion. And so the key focus there has been on how we have prepared prior to COVID, what we have done since COVID, and where we're headed in terms of this particular season, both from a COVID perspective, but generally also from the hurricane season perspective. So in terms of the interpandemic phase, this, of course, explains the phase between two pandemics, the last one being the H1N1 era, 2008, 2009. And there are a number of things that were done since then, having learned many lessons from that period. So what did we intend to achieve? Preparation of all sectors of the society for a response, a strengthened response to the pandemic threat. So we had a pandemic plan that was developed. We branded now the COVID plan, but it actually started as a result of H1N1. A disaster risk management apparatus mobilized, clinical and primary healthcare system assessed and strengthened for response, and the public education program. The alert phase, which has taken place up to this point, even though I think we're somewhere between alert and epidemic phase, we're in the pandemic phase. The alert phase really tried to achieve a delay in the disease crossing our borders coming into Jamaica. And there are a number of actions that were taken to support that. Restrictions, as you know, on travel, quarantine isolation protocols, and then having had the first case of COVID-19 identified within a particular period. So we did achieve some amount of delay. And then the epidemic phase, managing and controlling the spread and impact of the disease. And generally speaking, I think we have done well. And what we have sought to do is to institutionalize those arrangements, if you will, the structure, which we will transfer and use as needs be for the hurricane season. So in terms of the recovery phase, the strategic objective is to build back better, strong, and more resilient. So we learn as we go along. Preparation for the hurricane season 2020, the areas of focus would be the gap analysis for primary healthcare facilities, an analysis for secondary facilities, the public health risk communication strategy which is being developed, procurement needs and restocking of emergency supplies, which is underway, looking at what we would need in case of a hurricane-related emergency, assessment of shelters across the country, which is now taking place, and disaster response plans reviewed and updated for all health facilities within the public health infrastructure across the country, both hospitals and of course, health centers. So all of this represents the sort of overarching approach that we will take in preparation for the season. The next slide looks at the direction and coordination activities. Our Emergency Operating Center continues to be coordinated through the Emergency Disaster Management and Special Services Branch. So we work, of course, very closely with Minister Mackenzie, who has the Emergency Disaster Management apparatus within his ministry. We have set up a new Emergency Operating Center, which is very technology-driven at the IBM building in New Kingston. That was opened about 6 weeks to 2 months ago. And it's very able to respond and to coordinate from that location across the country. Emergency management training on mass casualty, damage loss assessment, and other critical life-saving activities have been triggered. The Smart Hospital program has been ongoing, and that looks at, among other things, how we ensure that that infrastructure is in place and can withstand hurricane conditions so that after the event we can cope with dealing with the cleanup and the response. We can't afford to be down after a hurricane because clearly we are critical to saving lives. And then the environmental health interventions are ongoing to monitoring the health program throughout the country. Almost completed. Where are we now? Hurricane preparedness plans have been drafted by all facilities and are to be submitted to the Health Emergency Operating Center for finalization. So those plans are being done now by the regional health authorities. Costing of gaps and procurement plan being finalized for procurement action by the authorities also. Emergency supply for critical drugs is now ongoing, and some of that has taken place already in terms of procurement. The operating center is in full swing given the COVID response, and therefore it is up and running and able to adjust accordingly depending on any possible hurricane-related emergency. And review and restructure of the Emergency Disaster Management and Special Services branch of the ministry to increase capacity to respond to multiple interventions. This year, frankly speaking, let's hope that the projections of an active season does not materialize over the next number of months. And finally, next steps: participate in all national hurricane preparedness actions where available and will continue to do so. Finalize the procurement of stock, monitor and manage all the stock levels to ensure we are not out of stock. And in terms of being a critical part of the parish, regional, and national levels for health, that is a part of the plan that we are working on now. And you would have heard that we had announced, with the support of the Ministry of Finance, an additional number of community health aides, primarily for COVID. We're now actively recruiting and training those community health aides. They will become a critical part of the health extension at the community level to provide critical educational and other coordinating support for any disaster. And hurricane during this season clearly would be one of the areas that we would have trained them in.